Good afternoon, Jaguar Nation, and thank you so much for watching and for tuning in. And we thought we'd have an opportunity to sort of fill you in on what's been going on. You know, it seems like several months ago, but it's only been a little less than a week, I think, from the last time that I had a chance to spend time with you. And so I appreciate the chance to do this. And again, instead of being able to talk to you like I normally like to do, I'm going to have to spend a lot of time looking down. I hope you'll forgive me for that. But it's an opportunity for me to really try to stay on task here and make sure that I get you all the information out that I want to be able to get to you. So if you'll bear with me on this venue, and hopefully this will still be informative and you'll get something out of it. So again, I do want to thank you all very much for tuning in and for watching. I know that many of you are accessing our website, our social media, and our videos, and our emails, and messages, and I hope that that's an effective way of keeping you engaged in what's going on. And you have remained engaged with us, and we're working hard to communicate important, accurate information to you as quickly as we can, because as you know, this is a very fluid and dynamic situation. It's changing literally hourly, not even daily anymore. So really stay abreast of what's going on. Check the augusta.edu website. Go to the COVID-19 banner at the very top. Check the CDC website. Stay engaged. Keep up with what's going on. I'll continue to try to have virtual town halls at regular intervals, and I know that our other leaders, both at the academic side on the university and the health system, will continue to use technology to communicate with you. But it's very important that you continue to monitor our website, as I've mentioned, and it's also important that the leaders and managers continue to communicate with their staff as they receive information from us. Thanks to Augusta University and Augusta University Health System community. I tell you, folks, I've never been more proud. I've always known we've got some of the best staff and faculty in the entire country, but they have all shown their true colors this time around, and I tell you, I'm incredibly proud to be standing before you as a cheerleader, as a representative of these incredible professionals. These are indeed unprecedented times. Everyone is working hard to do what they can to contribute to the effort during this unprecedented challenge. And there are too many people for me to name right now. I'm going to name a few, and you'll have to forgive me if I overlook someone, but I can tell you that, again, I'm just incredibly proud of how our team has come together. On the AU Health System side, thank you to Katrina Kiefer, our AUHS Health System CEO, and Dr. Charlie Howell, AUMA CEO, Dr. Philip Koo, our Chief Medical Officer, Laura Brower, Chief Nursing Officer, Dr. David Hess, the Dean of the Medical School. That's just to name a very few. They and all of the faculty and staff, our healthcare providers, and our administrators have just been working overtime day in and day out of this past several weeks. These folks are at the true epicenter of the crisis that we're currently in, and they're spending an awful lot of their time doing the good work and taking care of the citizens of this community and beyond. On the academic side of the house, thanks very much to Provost Gretchen Kaufman and to Zach Kelleher, the VP for Instruction and Innovation, to all our deans who are having to implement a lot of policies, a lot of procedures, and having to do it in such an incredibly short turnaround. To Susan Davies, Vice President for Enrollment and Student Affairs, and her entire office. They are the boots on the ground that have really been working hand in hand, virtually hand in hand with our students, and we're so grateful for all of them. And thanks to all of our leaders at the local, state, and national level. I had the opportunity today to brief our local delegation, representatives from the Augusta area that represent us so well in Atlanta. We appreciate everything that they do, and I had a chance to speak with them today to bring them up to speed on where we are and what's going on. I've been in contact with our mayor, Hardy Davis, and I'm so grateful for his leadership and for his entire staff and everything that he's doing, working hand in hand, virtually hand in hand with us here in Augusta to take care of the citizens of this great community. We are open for business. Let me be clear about that. We are open for business, but it is certainly not business as usual. As you hear me say over and over again, our top priority and our only priority is our students and our patients, and everything we do here is centered around making sure we provide the greatest education we can for our students and the most compassionate state-of-the-art care for our patients. And at times like this is when we really shine as an institution. Let me begin with our patients. As you know, we're the state of Georgia's only public academic medical center, and under a great leadership, we're bringing the full resources of that enterprise to bear on this crisis. Our health system leadership team and our clinicians have worked hard to create a plan to manage the health needs of our community. Our researchers have been hard at work in the laboratory developing testing resources for our clinicians to use in effectively treating our patients. And let me just give a shout out to some of our clinical faculty in the lab. They have created from what I've been told, is the first and only in-house COVID-19 test in the state, other than what you can get at the CDC and the Department of Public Health. I'm sure there'll be others over the next coming weeks, but we developed it in-house and made it available to our staff here, and it is having a tremendous major positive impact in our ability to be able to diagnose the patients who need the care the most by having an in-house test. It's been absolutely incredible. I'm very proud of the expertise that we have here. For the protection of our employees and our patients, we've had to make some minor updates to the operations of our health system. Elective procedures will not be performed today through Sunday, April 5th. We'll reevaluate the situation at that time, and we feel very strongly this is necessary to preserve the precious resources in the event of a surge of patients that may be in need. We are doing steps now, anticipating what the worst might be, so if that ever occurs, and we hope that it doesn't, we'll be prepared to handle it, and you should take great comfort in that. We're limiting visitors to our facilities to 1 per patient, all of whom will be screened at limited entrances, and individuals under 18 will not be allowed. Augusta University Health is a resource for our community for evaluation and testing of affected individuals. A COVID-19 hotline is available 24 hours a day, 7 days a week, for individuals who need to speak with a medical professional about whether they need additional evaluation for COVID-19. And any of you within the sound of my voice can call this hotline at 706-721-1852 for information. That's 706-721-1852, the COVID-19 hotline here at AU Health System if you need information. In addition to the hotline, I'm incredibly proud to tell you that we're providing virtual screening for the citizens of this area and beyond in the state of Georgia at no charge. You can download an app to use on your smartphone on Apple or Android platforms or on your desktop and laptop, and you can download that directly from the augustahealth.org/COVID-19 website, augustahealth.org/COVID-19. And I got to tell you, I want to thank our folks, and a lot of whom have already mentioned, for working overtime to bring that sort of platform to bear, where patients can register, list what their complaints are, put their medical history there, go into a virtual waiting room and have a live healthcare provider face-to-face through telehealth to be able to speak with and determine if they are in a situation where they need to go forward for testing. At the conclusion of the virtual screening, patients who need additional testing will be directed to make an appointment for drive-through specimen collection at our central location at Christenberry Fieldhouse. And this is the third arm, if you will, of the triage that we're doing on patients, to be able to be screened online to see if you need testing, to be able to have drive-through testing now where you can go and have testing done if you need testing, and be able to do it without getting out of your car, and then have that test being done in-house in a very rapid manner. We have the full gamut now covered, and we're very, very excited about that. Our location is at Christenberry Fieldhouse. Please know that you need to be screened first to determine if you need testing or if its testing is adequate for you. So please go to call the hotline or go to the augustahealth.org COVID-19 website, download that app, and see if you need screening. Most, if not all, of these tests will be processed at our own campus, which has significantly reduced turnaround time, so we can do testing in 2 hours. Typically, the quick turnaround will help us alleviate patients' fears more quickly and help us treat patients more quickly as well. It allows us to identify more quickly others that may need to be quarantined as a result of having been exposed to an individual that has, in fact, tested positive for COVID-19. Not everybody needs testing. Let me repeat that. Not everybody needs testing. And it's vitally important that you find out if you have symptoms, you need to find out if you really do need testing. If you've been exposed to someone who you know is positive, let's find out if you need testing by going to these resources before you come in. Let me tell you how well this system is working. So far, we've had 800 hotline calls, and we have directed 315 of these to virtual screening. 930 virtual screens with 185 sent to the drive-through testing for further evaluation. We had 50 specimens collected yesterday, which is the first day we opened this facility. And as of 2 p.m. today, we had 110 pre-scheduled drive-through testing patients today. And we expect an additional 50 to 60 per day. And we have the facility now where we can expand that if we need to. So far, we've had 9 positive cases that have identified by our laboratory, but only one of these individuals is currently housed as an inpatient. The others have been quarantined or isolated to their homes. Please know that as our ability to test increases, and that's true not only for here in Augusta, but throughout the state and indeed across the country, as our ability to be able to do tests on patients increases, we are going to see an increase in positive COVID-19 individuals. This is to be expected. This is what happens when you make testing more available. This is what we want. So please take comfort in the fact that we expect this, we're anticipating this, and this is a natural phenomenon based off the ability for testing. So please don't be concerned if you begin to see an uptick in the number of COVID-19 positive patients in our community, because it's going to be a phenomenon that's going to take place statewide and, in fact, countrywide. We're also working to help hospital and public health systems across our state with a new pandemic elective from Medical College of Georgia, where fourth-year medical students will receive online disaster medicine training and then be at healthcare facilities across Georgia. We're doing what the state's only public medical school should be doing. We're now preparing the future generations of physicians. So if this ever happens again, and we hope it never does, we'll have the physicians trained in real time for it. So that's the health system, and we're working just as hard for our students. And our students have gone through an awful lot in the past week, and we know that. We have a number of things to communicate with our students over the coming weeks. Please make sure you continue to check the COVID-19 website. Again, it's the very top of the augusta.edu website. Go to the COVID-19 resources tab, and it takes you right to information. Check our social media and ensure that you have your emergency contact information up to date and pounce. Our students' educational progress in pursuit of their degrees is continuing. Instruction is moving online. All current online courses that were in place prior to us ceasing face-to-face will continue uninterrupted. All the other courses will resume in an online and/or virtual format starting March the 30th. Some of our healthcare professions students are in a little bit different situations. Some of our PhD graduate assistants face some special challenges, and we have worked with their academic leadership to create instructional plans to allow them to continue their work. Our student life staff have been working hard on a plan to move students out of the residence halls. As you know, students who live in our residence halls have been instructed to move out. And what I'm about to tell you here is very, very important. If you are a student that has been living in one of our dorms here at Augusta University, please listen very, very carefully. All resident students can expect an email communication from Housing and Residence Life today, directing them with next steps for the move-out process. The instructions on the move-out process will be very specific, and you must follow these instructions to the letter very carefully. These instructions are designed to minimize your risk and the risk to our staff. We must avoid clustering of students and families, and we must continue to observe social distancing during this orderly move-out process. We're limiting only 5 students will be able to move out each hour per building, and they may be accompanied only by 2 guests. So if you're going to bring family with you, please do not bring any more than 2. You will not be allowed to have more than 2 individuals with you to help you move out. This move-out process will begin on Friday, March the 20th, and hopefully will be completed by the end of the day, Sunday, March the 29th. So as you can tell, we're taking our time to have a very orderly process to move out. Students will receive instructions about signing up for a time, and then will be confirmed by Housing and Residential Life team. Please, you will not be allowed into the residence hall at any other time than your assigned time. I hope you understand why we need to do this. If you feel that you must stay in the residence hall due to significant extenuating circumstances, and we have some students here now, you must seek permission from the Dean of Students in order to do so. This may include, for example, students enrolled in healthcare or clinical programs whose instruction has continued without interruption, as well as graduate research assistants. But, again, students who feel that they need to stay in the residence hall must submit an extenuating circumstances form with the request to the Dean of Students office, and you must have specific permission from the Dean of Students in order to remain in the dorm. I can't tell you how important this is. I know this is a stressful time for our students and their families. Jaguars care for each other, and we care as a university and will continue to support and engage our students during this time. Student counseling and psychological services are open for appointments, even as we speak on Somerville. Student health services is open for appointments on the health science campus. Testing and disability services are open and available. The University Police continue to work hard to keep us safe. The Dean of Students office is also available. If you need support, please contact them. That's what we're here for, especially for our open pause food pantry, student emergency fund, etc. Soon we'll be launching a website for students to indicate if they do not have access to technology for online learning beginning March the 30th, so be on the lookout for that. Beginning March the 30th, you will see virtual student activities, leadership opportunities, and wellness programming. Campus Recreation is already hosting workouts online. We want you to still stay engaged with the main campus, even though you're going to be studying from home. We want you to stay engaged with your university. We want you to keep physically and mentally safe, as well as educationally proficient, and we'll make sure that we can do that as best we can. Our instruction and innovation team is preparing some tips for student as we shift to online learning. Several students have asked about issuance of refunds. Please be patient. We are working through this issue even as we speak with the University System of Georgia and hope to be able to inform students about refunds as soon as next week. As you can imagine, this is a complicated matter. We want to be sure we get it right. We're working with the University System of Georgia to be sure we get it right, and we'll get information to you as soon as we can about refunds. So please be patient with us on that. These unprecedented circumstances have resulted in a number of changes to our schedule of events. As it is of today, spring break will remain as scheduled, and the spring semester will end as scheduled. Stay tuned for any changes you may see in schedule. A number of important events, conferences, and meetings across campus, for obvious reasons, have been canceled or postponed in an effort to comply with the need for social distancing. And most unfortunately, we've had to make the very difficult decision to postpone commencement. I know this is a really meaningful time for our graduates, for their families, and believe me, it also is for our faculty and staff who are so proud to see you walk across that stage. Even though we're going to have to postpone this, we're working to develop a plan to provide a way for us to celebrate your achievement, and we'll provide more details soon. So please stay tuned. And obviously, we couldn't do what we do as a university without our outstanding faculty and our staff. And let me take an opportunity to give a shout out to Susan Norton, our Vice President of Human Resources, and her entire office who have worked tirelessly to try to provide opportunities for our staff and our faculty. I'm incredibly grateful for your continued patience with us, with each other, and with our students and patients as we adapt to what is now a new normal. We are all managing through a great deal of ambiguity and changing circumstances. Please, faculty and staff, don't come to work if you're sick. Work with your supervisors to understand and best meet your obligations during this time. We are all working through the details of what teleworking and flex time looks like. Please be patient with us as we will be patient with you. We're all managing the need for remote access and technology. Again, Susan Norton and her team are working through how we can maintain appropriate levels of accountability as we continue to be open for business, even though we're not business as usual. So please be on the lookout for additional communications from them in the coming days. Be vigilant in observing the measures to protect your cybersecurity. As we go online, as our faculty are taking their courses online, as our staff are taking more of their work home and telecommuting by that, please be very much aware of cybersecurity We want to make sure that we keep our data and our networks safe, as well as we want to keep our staff, our students, and our patients safe as well. It is incumbent on leaders to communicate regularly with their staff and to communicate any challenges that they face and are facing and bring it up to our administrators. Communication during this time is absolutely essential. We realize it won't always be perfect, we'll stumble, but we need to make an ongoing effort to communicate with each other. HR is regularly updating our faculty FAQ statements to address common questions that they're receiving. And if you have a question, please go to the website and see if we have that question there. If you have a question, very likely somebody else has already asked it. We may already have an answer posted for you. But if you have a question that is not answered in that document, work through your chain of command to coordinate communication with HR. To our faculty, and now for our research faculty. The Research Administration, the IRB, and Department of Lab Animal Services have well-developed business continuity plans that they are executing, and all services are continuing. Individual research labs will continue to function, but they must do so with strict attention to social distancing, flex time, and minimization of contact. This is a fluid dynamic as well, and that policy could change. So please stay in touch, stay tuned, stay engaged. Graduate research assistants may enter labs to do work, but they and their mentors are strongly encouraged to shift their work to virtual and online elements of their projects during this time. Write your research papers, write your research grants, write your outcomes of your research. Do it from home, and please try to take responsibility for making sure we adhere to telework and to social distancing practices. AU libraries are staffed during regular working hours and are open to faculty upon appointment. For our instructional faculty, you are very busy, I know, adapting their courses to move online, effective all courses on Monday, March the 30th. We have a number of resources for our faculty who may not be accustomed to working online or have questions about how they can put that particular course online. The AU Center for Instruction Innovation built out the Augusta University Instructional Continuity website at www.augusta.edu/continuity. Please check that out. We're offering facilitated online course, Rapid Guide to Online Teaching. We already have 29 participants to date on that, and it's growing daily. We're offering facilitated online course called Web Accessibility and Usability. We have 17 participants to date already, and numbers grow there as well. We're providing an online course development template called AU Course Shell. The structure encourages good course design and reduces course development. We're offering 36 scheduled WebEx sessions between March 16th and March 30th to assist faculty with transition to online teaching. 19 faculty members have participated in that since Monday. And we're developing 5 one-pagers with tips on online instruction, such as how to use the gradebook in D2L, how to interact with students in the online course, and how to keep online students honest, along with the guerrilla marketing plan to promote those one-pagers, as well as a rapid guide to online teaching. We're trying to do everything we can to make it as easy and efficient for you to do the difficult task we know of converting a face-to-face institution to an online institution in this time of crisis. A lot of you have asked about volunteering your time and your talents. Many of you have asked how you can help. Our volunteer services and community engagement team are busy coordinating our efforts. Please watch for communications from them about how you might be able to help. Additionally, you have probably seen messages from our healthcare leadership about blood donations. The disruption of normal life has had a significant impact on our local blood banks. If you'd like to donate blood, please reach out to one of our local Shepherd Blood Donation Centers in your area to schedule an appointment. In conclusion today, I've just got some simple things to say. We're going to get through this. There is light at the end of the proverbial tunnel. We will get through this storm if we work together. Jaguar Nation is a powerful force, and we're working all hard to do all we can for our number one priority, for our students and our patients. Please stay calm, stay focused, stay home, and wash your hands. And ladies and gentlemen, we will get through this together. Thank you so much for your attention. I promise we'll try not to bombard you with information overload, but at the same time, we're going to do everything we can to keep you informed and keep you engaged. Thank you so much for being part of Jaguar Nation, and go Jags.